Welcome to the Red Flags and Review module of the REACH Parent Education Program. For our purposes, a red flag indicates a situation or problem that is potentially dangerous or life-threatening. It is important to recognize these situations and know what to do in order to help both you and your loved one. This last module will identify some red flag problems and briefly review the topics we have covered in our educational series. As we review red flag behaviors, remember that they are behaviors that should not be ignored. They are potentially dangerous, and trying to convince yourself that they are not can become part of the problem. When you understand the signs, you can often prevent a problem from happening. There are resources available to assist you if you encounter any of these behaviors, and when necessary, you need to contact these resources. Talk to your loved one about any red flag you believe relates to your situation. Red flag behaviors create victims and vulnerability, and it may be not only your loved one who is impacted, but other family members as well. Some of the red flag behaviors warrant a safety plan, which we will review again at the end of this module. If you found yourself or your family in a dangerous situation, what would you do to keep yourself safe? Who can you call? Where can you go if you need to get out of the house for a while? What can you do to keep your loved one from potentially harming himself or herself or others? One issue you may face as a parent is to evaluate whether your loved one should have access to guns. If your loved one has been diagnosed with depression, PTSD, or TBI, you should take steps to secure all firearms in your home or to remove them completely, at least temporarily. If your loved one has lost mobility, a limb, or cognitive skills, he or she may feel unable to face the future and become suicidal. Some grief can manifest itself in anger. Many injured service members turn to alcohol or other substances to cope with pain and depression, as well as sleep. All situations in which your loved one needs to be separated from guns. This can be very difficult. If your loved one suffers from the hypervigilance of PTSD, he or she may become agitated and scared without a gun for protection. Make sure the ammunition is stored securely and separately from any guns in the home. Perhaps a trusted friend or family member will agree to keep your guns for a few months as your loved one recovers. Trigger locks may be available for free from your local law enforcement or from Project ChildSafe. Keeping firearms out of your home is one means of preventing suicide. Unfortunately, firearms are not the only effective method of ending one's life. Suicidal people suffer from major clinical depression and need medical help. Knowing the signs of potential suicide is important. If your loved one threatens to kill him or herself, believe them. If your loved one talks frequently about death, dying, or suicide, pay attention. Uncontrolled anger and stating a need for revenge are also signs. If you note that your loved one feels hopeless about his or her condition or the future, or if your loved one withdraws socially from close friends, he or she may be suffering from depression. Reckless behavior and mood swings can also predispose one to suicide, as can the increased use or abuse of alcohol or drugs. When you see the signs, contact your loved one's doctor immediately. If you believe suicide is imminent, call 911. It is a medical emergency, or call the National Suicide Prevention Hotline at 1-800-273-8255 and press 1 for veterans. Anger is a normal human emotion that evolves from unmet physical or emotional needs. It usually does not appear out of nowhere. Your loved one may be struggling to control his or her emotions right now, and anger can be among these emotions. This is common with people who have PTSD, TBI, and depression. Anger has a cycle. If we understand the cycle and the potential outcomes, we can often prevent an eruption of anger from occurring. Anger usually begins with a lack of communication or miscommunication. Not telling someone what you need or not relating the need clearly or as urgently as necessary. Your loved one may be struggling with more than one human need right now. We have the need to feel competent. Injury can take this away. We need to feel we belong. Your loved one may feel that combat experience separates him from the civilian world. We need to feel understood by someone. Civilians cannot understand what the combat deployed have experienced. We need to feel useful, that we are needed. We need to feel that we have some control in our lives, and we need to feel optimistic about the future. Your loved one may be struggling with any one of these needs or more. Anger can develop from this struggle. Tension builds as the need remains unacknowledged or unmet. When the tension goes unaddressed, it builds and builds. An emotional explosion can occur. It can be violence to self or others. It may involve alcohol or other means to dull the anger. After the explosion, the angry person may feel relief or guilty or both. But without effective communication, the cycle of anger will begin again. There are symptoms of oncoming anger. If you recognize them, you may be able to prevent the explosion of anger. Signs include pacing, crying, head or arm rubbing, speaking with a challenging tone, or speaking increasingly faster. An angry person may begin making judgmental statements about others or the situation. He or she may begin cursing or raising his or her voice. Some people shut down or withdraw when they are very angry. They become noticeably quiet and withdrawn. Frustration with being unable to do the things they used to do can cause anger. Being unable to control a disorder or heal an injury can also make a person feel angry. Try to find the root of the anger and listen openly. Ask what is wrong and listen without interrupting or making judgmental statements. If you or something you have done has caused the anger, take responsibility for your part in it. Apologize if necessary. Validate your loved one's feelings. Seek to understand how he or she feels. There may be a very valid reason your loved one is upset. If the situation is escalating and your loved one is becoming more and more angry, try calling a timeout. You need to have boundaries in a relationship that include not verbally or physically attacking one another. Walk away if necessary. Do whatever you need to do to remain safe until your loved one calms down. A medical professional can help your loved one learn to manage emotions and anger, so if it happens frequently, get help. Helping your loved one get control early can prevent other dangerous events. Domestic violence generally refers to intimate partner violence, but it can also occur with anyone living in the same house as the abuser. It is not uncommon. Over one-third of women and a fourth of men in the United States have experienced rape, physical violence, or stalking by an intimate partner in their lifetime. Because many women and men do not report abuse, experts believe the number may be higher. Domestic abuse is an acknowledged problem in military families. Battle mind and family life do not often mesh well. The skills and mindset needed for combat are very separate from the skills needed to nurture a family. Multiple deployments, family separation and reintegration, demanding workloads at home and while on duty create a higher risk for domestic violence. In addition, a history of head trauma, mental illness, or substance abuse can all contribute to domestic violence for active duty service members and veterans. There is never, ever a reason for another person to physically abuse you. What begins as mild abuse, pushing, grabbing, shaking, usually escalates over time to far worse injury-causing events. Domestic violence is positively linked to both PTSD and depression. It usually stems from an inability to manage anger and other emotions, so do not ignore aggressive behaviors. Domestic violence is not limited to physical abuse. For a child, watching another adult be abused can be just as scary as being abused himself. It causes emotional injury. Abuse can be verbal, emotional, or sexual. It includes the threat of violence and any behavior meant to intimidate, instill fear, or attempt to control your behavior. It includes throwing objects at another person, holding the person down, or threatening them with a weapon. The Department of Defense and Veterans Affairs have resources available. For the Department of Defense, the Family Advocacy Program can help. If your son or daughter is on active duty, the DoD can counsel victims on their reporting options and help the victims find shelter or remove the abuser from the home. The abuser does not automatically lose military standing if charged with domestic violence. If the abuser agrees to and completes a treatment program and shows good faith and progress, the military standing will remain intact. An abuser who refuses to comply with treatment can be discharged. Counseling is available for all family members who are involved or who have witnessed the abuse. Most VA medical centers have a domestic violence counselor who can provide advice and service to your veteran. If you are ever in immediate danger, call 911 or the National Domestic Abuse Hotline at 1-800-799-7233. Just as PTSD and depression can increase the risk of domestic violence, they can also increase the chances of child abuse. If your loved one has children or younger siblings live in the house, be aware of this potential. There are 3 million reported cases of child abuse in the United States each year, and many more go unreported. Neglect is also a form of abuse. Your loved one may be so impacted by injury or mental health issues that he or she may be unable to properly care for a child at this time. You may not actually witness abuse, but only suspect it. Signs that a child is being abused include unexplained or poorly explained injuries or burns, wearing clothing to cover bruises even in warm weather, bald patches on the scalp, chronic running away, fear of medical examinations, aggression toward others, and fear of physical contact. Does the child flinch or shrink back if touched? Be on the lookout for these symptoms if you suspect child abuse. Other signs of potential child abuse are the child being overly knowledgeable about sex in a way that is inappropriate to age, chronic itching or pain in the genital area, contraction of a venereal disease, depression, self-mutilation, suicide attempts, overdosing, developing an eating disorder, isolating themselves, or displaying anxious behaviors. Sudden distrust of someone they know well or not wanting to be left alone with a particular person are also signs. The child may draw sexually explicit pictures or have the inability to focus in school. Regressive behaviors such as thumb sucking or bedwetting can also be signs that a child is experiencing stress of some sort. Chronic nightmares can also be an indication that something is wrong. If you suspect something is wrong, call a hotline. Child Help USA can be contacted online or at 1-800-422-4453, and the National Children's Alliance can be reached online. For educational resources and more contact information, go to www.memphiscac.org. Like domestic abuse, child abuse can escalate, and intervening may save a child's life. This red flag module was not created to alarm you. You may never need any of the information covered here. However, if one of these situations develops, now you know what to watch for, what to do, and where to turn for help. For any dangerous situation you may find yourself in, enact a safety plan as discussed at the beginning of the module. What will you do to stay safe? Who can you call? Where can you go? Ultimately, safety is the main concern for you and your loved one in the event of any of these situations. Awareness, education, and a plan are what you need to cope with red flag behaviors and to prevent some of them from happening. Dealing with firearms, potential suicide, anger, and violence may all involve danger with someone recovering from a severe injury or mental health issues. Don't expect any of these things to happen. Just be aware that these are issues and they are not uncommon. So be on the lookout. By completing these modules, you have learned about your loved one's injury or injuries, as well as about depression and substance abuse. Those who have endured a trauma are at high risk for both. The modules also reviewed injury-related symptoms and how to deal with them. Remember, your physical health is just as important as your loved one's. You need to stay healthy. Pay attention to what you eat, how much you exercise, and how much you sleep. If you feel emotionally overwhelmed, remember that this is normal and change is constantly happening. You will recover along with your loved one. Maintain your friendships and social support system, and be sure to reach out to the professional support systems available to you. Managing stress helps you to be more physically healthy and helps your mood as well. Take time out for you. If you are interested in reviewing any of the online resources reviewed in this webinar series, they follow on the next 2 slides. You may screenshot the slides or hit pause to jot down any that are important to you. Thank you for participating in the REACH Parent Research Program. We hope you found the modules to be educational and helpful. You may go back and review any of the modules you like at any time in the next 6 months. After the exit interview for this project, you will receive in the mail a special parent-caregiver notebook containing all the webinar module education and more. You will also be offered one-on-one caregiver support phone sessions with one of our program coaches if this is something you are interested in. Once again, thank you for contributing to research which will help parent caregivers like you. This concludes the series.